There we go. Right. All right. It is the top of the hour, everyone. Happy Monday. Welcome to our Maddie's Fun community conversation. My name is Jose Ocaño. I'm the founder and CEO of Hatching, where we help people live better and work better. And I'm joined today by my friend and colleague, Claire. Join us, Claire. Hello. How are you?
Hi, Jose. Hi, everyone. Happy Monday. Good to see you all.
We are really excited about the conversation we're going to have today. The title is Parvovirus Treatment Algorithm. And I know many of us who relate to parvovirus, whether that's in the shelters we work or whether you're a rescue organization and these are animals you're pulling from a shelter for community members. It's something that is always evolving. I remember 20 years ago when I first started, you didn't treat parvo like at all. And I know there are some shelters who are still in that position. So no matter where you are on your parvo journey and how you relate to it, we're excited for you to join some of our experts today on this really important topic. And one of the things we're going to be doing a little different is an interactive questions of the day that'll take place in a few minutes. Want to get everybody prepared because you're going to be using a platform in order for this to be live and engaging and we can actually see what each other are saying. So if you can check out the chat, you're going to go to menti.com and there's also an access code that you're going to use. And so in a few moments, Dr. Boyd will guide us through how to use that. But until then, I'm going to hand it over to my pal Claire, who's going to run the national updates.
Thank you, Jose. Hi, everyone. All right. So we want to make sure we have plenty of time for a really interactive and exciting presentation, like Jose mentioned. So we're going to open it up to national updates. You can unmute now. If you can just keep it under a minute so we have enough time to get to everyone. If you can't unmute and you want to put it in the chat, you are welcome to do that now. So would love to hear any national updates anybody has.
I
Thanks,
really
Jody,
want to
for
get
putting
Jeopardy music just for fun because, like,
I know, no one wants to go
I,
first. You can raise your hand if you'd like.
we're
Any
still getting
national
folks joining.
updates? I know. Yeah, we're starting these a little earlier too,
Hey,
so that's
Claire,
good. Yes.
it's
Hi.
me, Jyoti. I just put something into the chat, and that I'm starting up the meditations again that I've been doing for the past couple years now. I guess it's been over a year, and they're starting this Wednesday at 5 p.m. Pacific time, and anyone can join me. And you can have your videos on or off. Registration's right in the link there.
I highly, highly recommend the community that you get to be a part of with Dr. Robertson's meditations. They have immensely opened up my mind and my heart. So please come join us. All right. Perhaps no national updates. If you remember one, you can always add it in the chat. You can also post in the forum at any time. All right, Claire, what's next? I think we're going to intro
Perfect.
the magical Dr. Boyd.
Yes, absolutely. It's my pleasure. I'm very excited. It's going to be a great presentation today. But I'd like to introduce Dr. Azalea Boyd. She's going to be our moderator today. She is the Chief Veterinary Medical Officer, Urban Community Animal Care at Companions and Animals for Reform and Equity, otherwise known as CARE. And so, as Jose had mentioned, our topic today is parvovirus, the treatment algorithm. We're going to We'll review a new decision-making tool to help organizations decide if and when and how they might approach canine parvovirus cases and how to incorporate canine parvovirus monoclonal antibody, or otherwise known as CPMA. And it's the first and only treatment directed at the virus itself. Really exciting. So we're going to hear a little bit more about the protocols, and we will hear from two organizations that have successfully incorporated CPMA into their work to help save costs and improve life saving. So I'm going to kick it over to you, Dr. Boyd. Thank you for moderating today and being here.
Perfect. Thank you so much for that warm welcome and warm introduction. And then we will have the panelists give their introductions when their time comes. So I'm going to go ahead and share my screen. I already see people doing some work here. Can you guys let me know when you can see my screen? And while we are doing the screen sharing, if you haven't already, go ahead and go to menti.com. I don't know how you guys had the access code already. Some of you guys are cheating, but the access code is on the top. It is 7511-1260. So we don't have a bunch of Menti questions today. We just have the first three for the presentation. But basically, for those that are not familiar with Menti, you can enter as many questions as you'd like into this, many responses, into this question as you'd like. So the question is, when you hear the diagnosis of parvovirus, what's the first word that comes to mind? And as everyone is responding, those responses will come onto this board. The word that is entered the most is the one word that is the largest. So for example, in the middle here, we're seeing contagious. So that means we're having multiple people putting in contagious. So that is amazing. And we'll give you guys a few more seconds to keep putting things in here. Longer stay, puppies, diarrhea, treatable, sick puppies, bad smell. Yes, parvo does really smell. Unvaccinated, exposure. Yeah, so I think pretty much all of us on this call are very familiar with the effects of parvovirus and what parvovirus is. So you guys can continue to enter in there. I'm going to advance the slide and I'm going to pass it over to Dr. Brian to continue the next few questions.
Thanks, Dr. Boyd. Hello, everybody. Thanks for joining us today to chat about parvovirus for a bit. And thanks for that opening question. That's really great to see and kind of get everybody in the mindset of what we're going to be talking about. So the next question we have for you is on the screen, and I see folks are already responding there. So we wanted to get some idea before we kind of launch into our talk. How well do you understand the options for treatment of parvovirus? And as we'll discuss, there's lots of ways that we can treat parvovirus, maybe some more different and new ways now than we've had in the past. So just trying to gauge how well do you all feel like you understand the current options that are out there. You can just, I think you can just slide that bar over from not at all on the left over to very well on the right. Looks like folks are kind of feeling like they have some idea what the options are, maybe not expert in all of them. About 2/3 of the way up the line there seems to be where we're sort of settling. So I don't know if we can see how many responses are in there. Is that at the bottom there, Dr. Boyd? Is that?
We can't, so this just gives us an average of where everybody is. So it looks like everyone has a good understanding, at least, of what they think they know, right, about the options. I'll go ahead and advance to the next slide.
All right, so then we've got one more kind of launching question for you to target in on something that we're going to discuss today. And that is, what do you know about Canine Parvo Monoclonal Antibody? This is a new product that we're going to talk about. Sometimes it's referred to as CPMA. So have you never heard of it? No knowledge about it at all the way over on the left. Maybe you've heard about it before, but not studied it. Maybe you have a basic understanding. You might have a strong understanding and want deeper knowledge. And I also see that we probably have a few folks who are experts and have used it a number of times. As the numbers settle there, it looks like most folks either haven't heard of it or heard about it, but really don't know much about it. So that's great. We're going to present some information today. And so you guys will be able to move up in the bars there with at least a basic understanding and maybe feel comfortable giving it a try in your programs. All right, so thank you for that. It's really kind of great to set the stage and let us know how you guys are feeling and what you're thinking about as we go into this. So as was mentioned, my name is Brian DeGangi. I'm a clinical associate professor of shelter medicine at the University of Florida. And I'm going to start off the session today and just kind of give you a little bit of background about parvovirus treatment, just really in a nutshell, real high level, simple. And then we'll pass it off to Sherry and Dr. Comro, who can talk about how they handle parvovirus in their communities and in their programs. You can go on to the next slide. So as we saw from the opening questions, parvovirus is a problem everywhere for everybody. We know that in shelters more than anywhere else. And we know it's a problem year round. We know that it can be deadly. We know that it's really difficult to manage in shelters. Treatment can be really intensive, time intensive, consuming, expensive, can be a lot of work to deal with that. Nobody really looks forward to having parvo. I didn't see any sort of positive words. Maybe there was one treatable in there, which maybe is a positive aspect of it, but overwhelmingly the thoughts are negative. And so I just put this map up here because it kind of gives us an idea and an understanding that parvovirus is a problem all across the country, and certainly internationally as well. It's just not shown on the map that is here. And this is also a new map that I wanted to point out to folks that there is, we can put the link in the chat, or when you diagnose a case of parvovirus, the website that this will take you to is trying to get a hold of that and track it and let us know what's happening when around the country. And so as we start to build up that database, it might be helpful for people to look at what's happening in their area. Right now it's broken down by state. As far as, how many cases of parvovirus are being diagnosed, so we can try to get an understanding of what's going on a sort of real-time basis. So feel free to check that out and check on the map and see how things are going, and put your own numbers in there too to help sort of contribute to our national data and understanding of what's happening with parvovirus. Next slide. All right, so anybody who has been involved in parvovirus treatment, or maybe has decided that it's not for them, is probably familiar with all the different things that go into it. As I said, it can be really complicated, really time intensive, takes a lot of staff effort, and can be really difficult to deal with. And so we're not going to go into the real specifics of treatment today. If anybody wants sort of the veterinary and shelter medicine perspective on that, there's the infectious disease management textbook up there, and there's a whole chapter on managing parvovirus in animal shelters. But there are some really basic things that we've always relied on since the discovery of parvovirus to treat the disease, and it's making sure that they're receiving fluids, usually IV fluids, so that they stay hydrated. They're generally on antibiotics. They have anthelmintics is deworming. We need to make sure that there's no parasites in there on top of the parvovirus that are making things worse. Anti-nausea medications, pain management, making sure that they're taking in good nutrition. All these things are really key factors of helping these animals pull through their cases of parvovirus. And so one thing that all these treatment efforts, this is all we've had to rely on basically for the past 40 plus years. One thing they all have in common is that they're supportive care measures. They're just kind of treating the symptoms that the animal has until they can fight it off on their own. And so you can go on to the next slide. And so that's why we're really excited to hear about the Canine Parvovirus Monoclonal Antibody, because this is different than all the other measures we've had available before. This is the first and only treatment that is available that directly targets the virus itself. So we're not just dealing with the supportive care and the clinical signs anymore. We can actually directly target the virus. And so this product was released by Elanco last year, and it is conditionally approved by the USDA for use in puppies that are 8 weeks of age or older. It's given one time as a one-time intravenous injection, and we try to do that as early in the course of disease as possible to have the greatest effect. And what they've seen in the efficacy studies to prove that this product is effective is that puppies that are treated with the CPMA product, the amount of time that they are vomiting, that they are lethargic, that they're not eating is significantly shorter than in puppies that don't receive this treatment. So those are all the things that really keep these animals in the hospital, keep them feeling sick, and are really expensive for if you're dealing with a client-owned situation. And then the other key thing that they've discovered is that puppies that are treated, or dogs, I should say, that are treated with CPMA, they have less shedding of the virus as they're recovering. And so that duration of time that they're shedding and the amount of virus that they're shedding is less. And that's really important for us in shelter settings because we're concerned about contamination of the environment and making sure that one infected puppy doesn't spread to the others. And so again, puppies that are treated with this will shed the virus less amount and for a shorter duration. So there's less contamination in the environment. We can go on to the next slide. So with this new option in mind, we wanted to create some sort of a plan to help folks understand how are they ready to treat parvovirus, or maybe they want to expand the program that they have. I want to look at how can we do this really well, safely, humanely, effectively. And so we put together this this algorithm that you see here. And so there's the QR code will take you directly to this algorithm. We may also have a link that's a pretty long, unwieldy link, but we can probably pop that in the chat as well to get you there directly. But there's a few key things that we want to think about when we're trying to decide what to do with our own parvovirus program. And so I won't go through every detail on here, but just hit sort of the highlights. So one big bucket is to look at the facility that you're in. Do you have a facility that's going to allow you to manage it safely without spreading to other animals? The next thing is looking at your personnel. So both veterinary personnel to sort of direct the treatment plan and make some of those individual patient care decisions. And then also all the staff that are going to be caring for these animals and monitoring them and making sure that they get the treatments that they need and recover successfully. And so we have to look at those two things separately because they look very different in different organizations. So the algorithm will take you through yes, no questions, figuring out where you stand with those two buckets of items. And if you go on to the next slide, there's two more categories that the algorithm will walk you through. One is the time. So you might have the people, but maybe they don't have the time to actually do this. And so it walks you through, do we have the time for monitoring and treatment, and what is the impact on that going to be on the rest of the population and the rest of the services that you might want to be providing as an organization? And then finally, of course, we're going to think about the finances because there are obviously are going to be costs associated with all of this. And so looking at different ways that we can cover the financial costs for this and see how we can make this work. And so if we kind of get through the end of the algorithm and you've considered all those things, it'll take you to the box that says consider shelter-based treatment protocol. And then on the next slide, we can see some specifics about the treatment courses. And so this sort of second page of the document will walk you through what might your treatment options be. We know there's a variety of ways we can successfully treat parvovirus. And so what we know from the literature and from our experience is that it depends on how severely the animals are affected. If they have any specific clinical signs that we know are associated with a bad outcome, like being underweight or having a low body temperature when they first come in, we're going to handle those animals a little bit differently as far as what treatment options are available for them. And so this will walk you through that and give you one of three treatment plan recommendations. And you can go on to the next slide here. And so those options are going to be an inpatient treatment protocol, which is probably similar to what you would get at a sort of full service hospital. An outpatient protocol, which maybe if you're dealing with a client-owned animal, they may come in for treatments, you maybe provide some things and they can do others at home, or maybe it's an animal that's being managed in a foster home. And then there's also an exposed patient protocol who we're not quite sure are infected, but they have had a meaningful exposure, so we do need to monitor them and do a few things. So this will walk you through all the different aspects of that. The main components being making sure that they stay hydrated, making sure that their blood sugar level stays normal, and then neutralizing that virus with CPMA when that's available to you, in addition to all the supportive care things that we know are important to helping them make them feel better and recover more quickly. So this will walk you through in general terms how to do that and when it's safe to release them, move them out to adoption and out of any sort of intensive care setting. So with that, I think that is my last slide. So we'll pass it off to Sherry.
Oh, you already had a cup.
Some
Do you want
how this works
Pepsi
in
or?
real life.
Okay. I think we had a little interference there. Thank you so much for that information, Brian. And as someone who visits the emergency hospital as an emergency veterinarian, I see that this could be super beneficial. Unfortunately, the hospitals that I have been at, they have elected not to start using CPMA. But from what you said, what's really exciting is the fact that it lessens the amount of time potentially that patients would need to be hospitalized, if that's what I'm hearing. So when we talk about these heavy costs associated with in-hospital treatment for parvo, it sounds like CPMA is actually reducing the amount of time that patients are in hospital, which is amazing. the other thing that really stuck out was the fact that you can use it as an outpatient. So even if patients are not hospitalized, you can still use it as an outpatient protocol. And so I love the algorithms. I think that is amazing. And I think that was all great information. Jose, did you have a question maybe that you want to share from the chat?
Yeah, there's a few questions kind of relating to what is the cost per treatment? And so I don't know if that's something we have some of that info on, because I know it might also vary, right, docs?
So the others can comment on how the cost works in their settings of the Parvo ICU and a treatment and a shelter. But I know the direct cost to a veterinarian has to be it's a prescription product, so a veterinarian has to order it. The direct cost is $200 will treat an 11 pounds of a dog. So it depends on the weight of the dog, but that's sort of how much product you can get.
Great, yeah, thank you. Because I think one of the other questions was wanting to understand the cost so that folks can fundraise for these efforts. Because, I think this is something that people in the community, even donors, volunteers, fosters, want to support. Thank you so much. All right, back to you, Dr. Boyd.
Okay, yeah, sounds good. So, Sherry, this is your time to shine. We are so excited to hear about the Fix project. So, Sherry, please introduce yourself, and then can you start by giving us an overview of the Fix project and the key initiatives that your program focuses on, and then just how have you guys integrated CPMA treatment into your existing protocols and programs?
Hi, everyone. I'm Sherry from Fix Project. I'm one of the owners and rescuer. We started our clinic as a spay neuter clinic, and then we had the opportunity to buy this big hospital, and the back room was just like an old grooming room. And me being in rescue in Los Angeles and the hundreds of parvo that comes through just through shelters or just on web pages of people pleading like, help, I need help. I just thought, let's convert this old room into a parvo room. And then we had the opportunity to go to Austin Pets Alive with our vet team and our RVTs and stay there for 3 days and work. And they showed us their protocols and their regimen. And we just like moved forward. We had a little pushback from some vets because I thought, oh, it's a seasonal thing. And I'm like, I'm not a vet, but I've been rescuing for 30 years. And to me, it's not.
Uh-oh, I think we lost her for a second. Maybe, Jose, if there was, while we're waiting for Sherry to reconnect, was there another CPMA related question you thought would be good for Brian to answer?
See, let me go back. And then Claire, if you saw any, because I think there was something, I assume the vaccine isn't being tested for Panluc in kittens. I've always heard Panluc is the same as parvo in dogs.
So panleukopenia in cats and parvovirus in dogs they're both parvoviruses, and they are distantly related to each other. There is separate vaccine for dogs and a separate vaccine for cats. So I don't know if that answers the question. Some folks don't know that you can actually use the dog parvovirus test to test for panleukopenia in cats. That's important for folks to know. But otherwise, the vaccination is a different product.
CPMA is not for cats, not for
Yeah,
parvo.
there it is.
It's not labeled for cats.
Yeah.
All right, and it may be, I think she perhaps is popping off and is going to log back on. So we'll just give her a few moments.
Okay. What about, would it be appropriate for us to advance slide and maybe talk to Peggy Adams, Animal Rescue? Brian, would that be okay?
Yeah, I think that sounds good. Assuming Dr. Comro is ready to go.
Yeah.
All right. Sounds
All right,
good. Take it
sure.
away, Dr. Comro.
Okay, so I'm Dr. Alyssa Comro. I am the Director of Veterinary Medicine, or the Medical Director at Peggy Adams Animal Rescue League. So we are a nonprofit limited admission animal shelter in West Palm Beach. Just to give you a basic idea of the size, we take about 7,000 dogs and cats in each year. We also have a pretty robust safety net program where we are helping people who cannot afford to keep their pets for whatever reason, be it medical, that it's vaccines in spay neuter or parvo, or temporary housing if they've become unhoused for a short period of time. So how we get our parvo cases, the two main ones are transferring them in from other shelters, either knowing ahead of time that the pet has parvo and agreeing to take them, or it's a surprise. And then for our safety net program, so for people that cannot afford that care for their pets. And then we do get them sometimes stray or owner surrendered. Another little bit about us, we do have, including myself, 7 veterinarians. So we do have vets here 7 days a week. That does allow us to do many of the treatments that we do. Can advance slide. Do next, perfect. So our first experience with the CPMA was August 2023. So the first dog we administered it to, her name was Stevie. She came in really bad shape. She honestly was too advanced with disease, but I think that we were excited to use it for the first time, and we administered it to her, and she did pass overnight. So that was a really hard lesson, an expensive lesson for us to learn to be a bit more intentional with patient selection, and I'll get into that in a couple slides as to how we make that decision now. Her puppies arrived the following morning. 3 had begun having symptoms overnight and did test positive for parvo. The other 2 were asymptomatic on arrival, and we did administer CPMA to all 5. Knowing how sick mom got, we knew that the babies were not going to have protection for parvovirus, so we felt that it was important to treat the whole family. And they all did really well. The 3 that were minimally symptomatic, their symptoms never progressed, and the 2 that had tested negative never did test positive for parvo. And knowing, again, that they didn't have mom's maternal antibodies, we felt confident that the CPMA was what allowed them to do so well and really not to get sick. So the following month, it should say September 2023, not 2024 on there. But we had a litter of 8 puppies came in, and that was when the CPMA was on back order. For those of you that are using it a lot, you knew there was a couple months there where you couldn't get your hands on any of it. And all of those puppies became very, very sick, and we did end up having 2 puppies die. So that really allowed us to see the difference between CPMA treated and not. And granted, yes, it's only 2 sample sizes, but it was just so clear to us how well the 5 did that had the treatment and how sick and traditional the disease course was with the 8 that couldn't be treated. Next slide, please. So for patient selection, we select patients that we would normally treat for inpatient or outpatient protocols. So if it's a patient that we know is likely not going to make it, we do not administer it to them. We also will administer it to litter mates of young puppies and small puppies that have parvo. So say that litter of 6-week-old puppies, it's a litter of 4, 2 of them test positive. We will administer it to all 4 of them. The studies that Elanco has done shows that the earlier you give the product, the better chance they have. So in those cases, we see it as really early in the process or even preventative. We don't do that for larger puppies. So we recently did have an 8-month-old, like 40-pound puppy come from another shelter, and he did have a litter mate. We did not administer it to his litter mate, but they also tend to do better. So we really look at the patients we have and how they're going to do to make that decision. And then part of the reason we do that is because puppies do tend to come with comorbidities, be it intestinal parasites, severe flea infestations, canine infectious respiratory disease, that we really want to give them the best chance that we can, knowing that if they get parvo on top of having those other things, they're likely to get sicker. Next slide. So for treatment, so for safety net pets, we do either in or outpatient treatment, depending on the patient and depending on what that owner can do. Many of our safety net clients cannot bring them in for daily treatments. So we would do inpatient care, even if the protocol we used was more outpatient. For shelter pets, they get moved directly to isolation. And then I will say I had not seen the algorithm previously, but in going through it, it is exactly what we do. So fluids, IV or sub-Q, depending on what that pet needs. Because the CPMA is IV treatment, I've seen that we've been doing a bit more IV fluids because they already have a catheter in. And then we're only here for 10 hours a day. So we will put them on like a dial-a-dose line instead of the fluid pump, so that if it does occlude overnight, it's not screaming in the poor puppy's ear all night. Sometimes we have to do dextrose supplementation. We had a run of like really little Yorkie things for a while, and many of them needed that. They, of course, get the CPMA. For the antibiotics, we all immediately go to Convenia. We do not have an exact protocol with so many different veterinarians. We do allow each vet to kind of make their own decisions, but we do all practice very similarly. So sometimes then we'll move into metronidazole as well. They all get dewormed. In our area, we do have a lot of coccidia, so we will do canazeral as well as pyrantel. For analgesics, we will do usually buprenorphine. It doesn't last a full 12 hours in dogs, but it's the longest acting opioid we have. And then we will do Serenia, sometimes famotidine, sometimes metoclopramide, really depending on what that puppy needs. And then there's one more that I can't see on the screen right now, but it's nutrition. So we will try to feed. We're not placing feeding tubes. It's not really something that we can do here and be able to care for appropriately. So we'll often do entice if they're not really interested in eating, and then giving them a variety of food to try. Next slide. So recovery. So once clinical signs have resolved, we will use the SNAP Parvo test, and if they're negative, they will get a bath and they will move out of isolation. Sometimes it's back with their owner, sometimes it's on through our adoption program, sometimes it's the foster because they have other stuff going on. With the CPMA, what we found is a very fast resolution of panleukopenia. We had an intern with us and we had a run of parvo puppies while she was here. And we have in-house blood work, and she had asked, can I do some serial CBCs? We said, sure. And we found that the panleukopenia resolved very, very quickly. Like in the couple of puppies that she had done within 2 days, which was impressive. And then a decreased time in isolation. So previously we were isolating them by the time clinical signs resolved and they tested negative was usually 7 to 9 days. And now we're seeing them clear 5 to 7 days. And honestly, we probably could clear some of them quicker, but I think we're a little nervous. But it's really been an absolute game changer. Any dog that tests positive for parvo does get CPMA regardless of size. And we've had really, really good luck with it. Highly recommend.
Doc, do you want to, just for those that are non-veterinarians, just go over panleukopenia and what that means?
Oh, sure. I didn't even think about that. Thank you. So panleukopenia is low white blood cells. So it's not just one type of white blood cell. The reason it's called pan is that it's many of them. So with parvovirus, and that's why parvo in cats panleuc is called that, is because it is an overall lowering of those white blood cells. So with parvo, you can do blood work and you will see a very, very low number of white blood cells. And with this treatment, we have seen that their white blood cells become back in the normal range much faster than they would be if their body was just trying to heal them themselves.
Thank you. Okay, so that was awesome. Jose, I don't know if we have any questions for Dr. Comro.
There was one question, but
Okay.
it was answered with the presentation.
All right, awesome. Okay, Sherry, it looks like we have you back. So we are
I
going
am
to
back.
go.
I don't know if
Okay.
my computer died. I had it plugged in. So as I was saying, so we converted our grooming room to parvo, and it took off from there. Rescues went out. I can try to do a little video. Let me see if I can have the best computer person here. So we took our room and we tiled the whole entire room. And then we have our own like washer and dryer, and everything is completely in. We have all the plugs in the ceiling, so there's no cords. It's fairly a large room. I'm sorry, probably getting everyone sick. If I can try to reverse it over, I will. It's a very large room. So what's really nice is when we get our parvo clients in, they come in here, we put a brand new TV up on the wall. We have music. So getting them we have skylights in the ceiling. So it feels like a little outside light. We've noticed a huge difference in just like picking up their spirits. We do tend to have a lot of volunteers that support in the community that want to come and just kind of hold the animals and get them through it. If we have litters of puppies, one may be doing better than the other one, we'll bring them down on the ground and we'll put a puppy pen up and we'll let them play and interact. And the one that's not eating encourages the other ones to eat. So rubbing their stomachs and just getting them moving around, even if they're super ill and they're not wanting to get up, they definitely want to be out of that cage. So we've noticed a huge difference in just getting them out, letting them walk around. and just kind of, I mean, it is a mess in here. I tell people it's very messy sometimes. We've had a run of large adult dogs, a lot of pitties, a lot of shepherds, a lot of Dobermans, 2 to 8 years. When I said we did go to Austin, we were shocked to see large dogs. And I thought, I've only done puppies, but I don't know if it's all the rains we've had here in California. Our spike goes up when we have rain, and I tell my staff, get ready, the phone's going to ring in 3 days. Everyone's coming in with their parvo cases. We were one of the very first hospitals to get the CPMA, so we're very honored. We've done 450 parvo dogs last year. We studied in, I thought of the idea in 2022 in October, went out to Austin, and by the end of that year, we started just running with our parvo program. Rescue community was first on board just to kind of try it out to see how many we could do and give them full-time care. So with that being said, we had people didn't, a lot of vets didn't even really know about the CPMA because they're calling their vets, and they're, you know, all the rescues were out there telling everyone about it and getting them on board. We do a lot of work with the local shelters. Back in the day, it would be, you know, they would just immediately euthanize on intake. And now with the program and the community, people are, it's like they have till 5 p.m. So if they can get to us, or, you know, get a transport to us and get them to us right away to do the CPMA and get them on track. We do a ton of outpatient treatment. We were on the fence about it, but we had a breeder come to us. You know, we're a nonprofit, low-cost spay neuter. So she had 10. Mom and dad were fully vaccinated, full records, very healthy. She caught them right away. Like one puppy was not eating and she got them tested. So we tested all of them. All 9 tested very strong positive, 1 mild positive. So we did outpatient treatment of all 10 of them in the parking lot. And she had a good success rate, I'm going to say from, let's say 3 to 8 days, because it was a trickle down effect. The first ones that she got on board, that she caught right away. And then just obviously they were having the parvo signs and testing positive. So we've done a ton of outpatient treatment, people that can't afford the inpatient. And it's been, I'm going to have to say 99% success rate since we've doing a ton of outpatient, because we've been remodeling our room to make it bigger. And so it's, for the last few months, we've been doing mostly outpatient, and that's been really successful. But the trick is catching it. We have a sheet out front to ask people, like, when did you notice your dog? You bought your dog on Friday, it didn't eat for 4 days. Now you're 4 days in, is the CPMA going to work or not? You know, getting it right away is definitely a key, because you're really seeing that 3-day treatment like perking up. And if they're 3 or 4 day and we're giving the CPMA, it's the long haul. I mean, we've had some for 8 days in here, even with the CPMA. So maybe they've had it longer, or the people, you know, got it from a breeder. I'm not really exactly sure, but we try to do a long list of asking questions so we can get the protocol in our system with all the animals. The community donations have been great. Everybody's on board. Parvo to me is, I used to be it as a negative word. Now it's like, no, we got this. Like, you know, and all of the larger hospitals, they just don't want to deal with it. So they're happy that we started this, you know, little Parvo ICU unit, and they just transfer them over. You know, we get calls every single day of just transferring, because it is very contagious. You come in, we have shoes, you take everything off. Like I said, we learned from Austin, that's a lie. We took all your clothes, and I mean, not all your clothes, but you know, we have a shoe area, we have an area we just change and come in here. And like I said, hanging out's making it, you know, very, it's just, sorry, I get emotional on it because it's been such a long journey. And as a rescuer for so long, I felt like when I'd walk in a hospital, it was like this to me. And, you know, to have this clinic and save hundreds of animals because they would have never had a chance. I think it's getting a little bit more easier for people to realize, like, hey, your puppy can be saved. Don't have to euthanize because you don't have the funds. We work with people and we try our best to save every animal. We have breeders that drop their dogs off, they don't want to treat it, then we do an adoption program. So you know, we don't say no to any single parvo dog.
Yeah, that is amazing, Sherry, just to hear about the amount of success that you guys have had using CPMA. And you're getting lots of hearts in the chat because we're all feeling that little tug on our hearts. And many of us have been in situations where we've had to euthanize or recommended euthanasia for parvo. And so it's good to know that you guys have this much faith in using CPMA. And congratulations to you, because that's pretty much all of our dreams on this call is like to save animals' lives, right? So congratulations to you and the work that you and your team are doing.
I lived in this room all last year. My friends were like, "Where were you?" I'm like, "I'm in Parvo Nation." That's what I call it. I'm like, I sleep here, I stay here, we monitor the animals, and sometimes they can come in on death's door, and as we know, the next day they're like sprouting out. So having the CPMA, it's like our liquid gold, and back to if someone's opening the clinic, we do get a lot of people dropping off and they don't have any money. We take it in. We will hook our dog up with puppy and then we'll wait. And I have a really good story. I had a lady that had a Yorkie. She couldn't afford it. It was $12,000 at the vet down the street for 3 days. She came in crying. The dog was 2 pounds. And I had just gotten another little Yorkie. Maybe it was from the same litter. I don't know. And I said, "Hey, do you mind, because we were limited on the CPMA. So, I said, "Do you mind if I share your vial with her that it doesn't have an owner?" And so I share the vial because it's for 10 pounds. So I got 2, we do get to use a lot because we have high volume. So it was so nice. And both the dogs were saved. And I got a picture with her together, and her dog survived. A little rescue dog survived and found its own home. So, people in the community are for it. And we had the Parvo, we had Parvo Awareness Day. We had a big barbecue. I didn't want people to think like it's a bad thing. So we had a big barbecue. We had people that survived their Parvo dogs and come and meet and greet. And then we do once a month high volume vaccine clinics just to get people going. They still don't understand about the vaccine. It's like, please follow protocol. I tell people in the parking lot when they're crying, I said, it's the least you could do. You got your dog. The vaccine is the least expense. The Parvo is not. So, that's the thing, is still people aren't knowledgeable on vaccines.
Yeah, I think that is amazing. And I think we should probably all have Parvo barbecues now, because that's a great idea. Honestly, because so much of this is education, right? And so much of this is getting the right, correct information to communities so that we don't even, essentially not trying to get you out of business here, Brian, but it would be wonderful if we had a world where we didn't need CPMA, right?
Yes.
It's beautiful that we have it, and it looks like your facility is amazing. So thank goodness you got to see some of the sunshine living in there as well. But yeah, I think that is amazing. I think that everything that was shared today about CPMA has given everyone on the call some additional insight, and maybe those places that have been hesitant to use it will start to push, management and give them the nudge, like, this stuff is actually working. It is quote unquote liquid gold, right? And I think that is a beautiful thing. So I am going to hand it over to Jose. I think we've come to the part of the presentation where there might be some questions. And so I'll get to the final slide here so that you guys can get everyone's contact information that presented today.
Can I interject just one last thing? I put this bag together. It's our Parvo bag, and it has a bottle in it because we're in LA. So we have a go home packet because a lot of people live in condos and apartments, and you will see like the flow of, oh, that dog had Parvo, and then now their neighbor has Parvo. So we send them a bag of go home instructions because, oh, my dog survived. Yes, it may not be shedding. They don't know. So I say, fill up the bleach bottle, please clean, so we do try to do a go home, because that's the other problem. Even though that they're surviving, they're out there like still defecating in the community. So we do have a little go home baggie, and then they get a little bandana that says, "I survived Parvo."
Thank you, Sherry. So a question for our panelists is there grant funding available for shelters to acquire the CPMA? So like, I don't know if y'all, are using fundraising, whether that's at Peggy Adams or with your organization, Sherry. How do you go about funding, every dog getting this, who has Parvo, getting this treatment?
We have some local organizations that all they do is raise money for injured animals, whether it's like injured leg or anything like that, and then they'll give a percentage. So I try to educate people that come in and don't have any money at all. We have a list of like, go home, try to apply for some grants. We do have a little bit on the side. We can help a couple hundred here or there. And it's and Long Beach is a very great community for animals. So we just put it out there on social media, and then just try our best and do fundraisers. We're doing a Parvo fundraiser at the end of the year so that we can facilitate people coming in that can't afford it. We had a gentleman, a homeless man, came in and his dog had Parvo and his like the last $100. I'm like, I'm not even take your money. So we completely treated his dog, and he's like, I'll clean your parking lot, do whatever. And he comes by all the time and just comes and helps. And it's so nice because he was, someone on, that was living in the street and trying to stay away from drugs, and his dog kept him alive. So, now he gets to keep his dog too. So we have a lot of heartwarming stories like that.
What about for you, Dr. Comro?
So we don't have, I'm not aware of any very specific funding for CPMA. Our funding for treating either in-shelter patients or safety net patients are just funding through other sources. Because yes, $200 for an 11-pound puppy is a lot, but if I start adding up staff time and other medications that I would need to be doing, keeping these animals in isolation longer, needing more extensive care, especially for the little guys, it might even be more cost effective to administer the CPMA versus not. It is relatively long dated. It lives in your freezer. Like, it has been very easy for us to keep here. So it's something that we haven't had a huge issue with the cost of, because we were already treating Parvo and spending a lot of money in staff time and medications.
No, thank you. Yeah, and I think what I tell folks too, it's like when you tell stories, and I think you were talking about this, Sherry, like when you ask the community, here's what's going on and here's where you can help, and here's how we're saving lives, people want to help, they want to participate. We just have to be open and honest and make it easy for them to press that button if it's financially what you're looking for. Let's see, we have one more question. I think this is going to go to you, Dr. D, and it's, do you know of any additional research that is being done on CPMA beyond the initial Elanco study?
Yeah, so I know research is being done. I don't know any specifics or anything that I can share details about, but I've talked to lots of folks that have been using it. There are lots of shelters that are using it, collecting their own data on some of the things that both Sherry and Dr. Carl were talking about, like how much is it costing, how much is it saving in terms of length of stay on the animals. There are shelters that are reporting that it's helping them move them through more quickly, which is what we would expect. They're collecting that data. And I know there's other scientific studies going on in some of the universities and more research settings as far as different ways to use the product and different ages and scenarios. So it is happening. I don't know any details, but watch this space and we'll be sharing all the information when it comes out.
Awesome. Well, thank you to all of our panelists. Thank you, Dr. Boyd, for facilitating this, and for all of the team members who work on this behind the scenes in preparation for these community conversations. I appreciate you. I think I'll close out with Happy Pride Month. It's June, even though Pride Month is every day for me. But yes, so happy Pride Month. And I think it's just really incredible to reflect on how far we have come as a movement. I'm telling you, when I first started in this industry, like no one was treating parvo. Like it was just like this is contagious, get this out as soon as possible. And when you had it in your shelter, you were depopulating. We were doing the best we could with what we knew, and people are still operating with those kinds of circumstances. So it's a really awesome thing to see folks like our panelists who are doing work to advance our ability to help more people and pets and preserve that human-animal bond with a population of animals that is so adoptable, right? Where we mostly see parvo in these cute little puppies. And so we hope that you glean some information that is helpful. You're inspired to explore some of this if this is something you're curious about doing. And continue the conversation on the Maddie's Pet Forum. If you have additional questions, our panelists will we'll be feeding over the questions over the panelists should you come up with any other questions. And we'll be back next week. And so we hope to see you then. Thank you again to everybody. Have a wonderful week and be well. Thank you.
Bye.
Adios.
Thanks, everyone.